Hello, good people. How are you? I hope you are all doing all right. Thank you so much for subscribing to my channel. Thank you for the returning subscribers for always keeping it locked here. I'm very grateful and thankful for all the subscribers who keep on coming back to my channel just to watch what's going on. Thank you so much, Gesla Woods. Thank you very much. Thank you, Arise for Fries. Thank you very much. Thank you, Douglas. All those people who come back. Thank you, just to mention but a few. I'm really grateful and thank you for always just watching my videos and just checking how your girl is doing. I honestly am grateful and thank you. Thank you. For Team Sharon, thank you for always keeping locked here. And despite the fact that I disappear, I appear again. Thank you very much for just staying tuned and just getting to find out what's going on. So I had a busy day today. Yeah, I was up and down doing errands and a lot of things going on. So I just came back home just now and thought I was just wondering in my head what should I talk about today. And because I really wanted just to have a chilled session, and I think I'll be doing this if you guys tell me on the comment section what you think about. I think in a week I'll be having like just a chilled session in the car, just getting to talk about different topics and different topics that affect us on a daily basis, on a day-to-day basis, and see how it goes about. So today I honestly wanted to talk about, because I've met different people, especially last month when it was Breast Cancer Awareness Month. I've met different ladies, I've met spouses, I've met son-in-laws. I've really met I met a lot of people who were just curious and wanted to know how I got to handle and how I'm still handling some of the side effects that come with the treatment. So I'll just mention just a few some of the few tricks that I used to do whenever I would get some of the side effects, because maybe some of you might not know. When you go through cancer treatment, especially the chemotherapy part, you get to experience a lot of changes and you get to experience a lot of side effects with it. Some of it is the number one that most people don't know. It's the becoming bald. People think that, oh, you're going through this, you've just decided, oh, let me just cut off my hair just to handle this, without knowing it's the chemo drugs that actually shave your hair. So you get that that's one of the side effects that a lot of ladies is usually the toughest. I would say so, because they say the hair is a woman's crown. So you can imagine you're used to your hair, and all of a sudden there's this thing that has come and it's going to take away your hair will go. And the good thing, the hair doesn't go like forever. It's not a forever thing, because after the treatment, with time, the hair will start growing back. Like in my scenario, yeah, today, yes, I'm rocking a wig, but you've seen let me just show you. Yeah, I was a bald head, but as you can see, my hair is growing back. So most ladies are always worried. How will I look? What will happen to me with the bald head? But the good thing, we have wigs. Yeah, we have wigs. No one can tell what's happening underneath your wig, because most ladies fear, like, how will I look, what will happen? But you forget about this, to me, I'll call these small details about the hair loss, and just focus on the main goal, which is just to get better. Yeah. So the other bit was the darkening, skin darkening, because with chemotherapy your skin color turns, you become dark, your face turns dark, your hands become black, your feet become dark, and there's nothing there's nothing as difficult as just getting to be asked this question over and over by people. Why is it that your hands are darkening? What's happening to your feet? I just wish people could just should I say really like mind their business, because you don't know what's making this person to look like this, not unless you just wait this person to voluntarily tell you, like, I'm going through this is happening to me. Because some of these questions, I used to find it a bit difficult. Like, I don't want to keep on talking about this, because personally to me, I would find it like I'm not happy about what's happening to my body. So I wasn't so comfortable talking about it every now and then. And you see, today you'll meet this person, tomorrow you'll meet another person with the same questions, like, what's happening to you? What's happening to this? I just just forget about it. If someone is not willing and open to tell you, like, I'm going through this, just brush it off and let it go. You don't have to ask. This is the same thing when it comes to weight gain. People are very inhuman at times with their question. You'll find people asking, oh, why hey, you've gained so much weight, what's happening to you? I don't know, this and this is happening, what is it? If someone is willing to tell you, then it's okay. But just to be human enough, avoid asking such kind of questions like, oh, why are you growing fat? Oh, why are you growing so thin? What's going on? And you see, at that moment there is so much going on. Today I'm just talking on behalf of cancer patients. Like, and that moment there's so much going on in your head. Your emotions are at peak. Like, anything can trigger anything, because obviously you're not happy about what's going on. You're not happy about the changes, and yet you meet people who keep on asking you all these questions. Yeah, but it's part of the treatment, because there are drugs you're given, they'll make you gain weight. There are people who lose weight, but personally I ended up gaining weight from the drugs, which was a good thing for me, because I was really worried. With most people, when they hear about cancer, they just think, oh, this person is gonna be emaciated, they are gonna be really tiny and thin. So that was my worry. But I was very positive about everything. Like, I made sure I'm eating right, everything. So it was a good thing for me. I added weight, and I'm still looking good. Yeah, because people meet me and then they're just like, you don't look like someone who is fighting cancer. So I'm just like, I don't know people who fight cancer how they look, but I'm just grateful that I had such a positive mindset when I was going through it. Yeah, so some of these changes, just be very human, and avoid like asking, like going deep and all this, especially let me talk about the caregivers. I think the caregivers have the toughest time whenever it comes to cancer patients, because they have to be there all the time. They have to show, I'm sorry, I'm just looking outside, I'm just seeing my my kids. They're trying to find where mama has gone. I don't want them to know that I'm in the car, because they'll come and they'll come and disturb me, and I won't be in a good position of shooting this video. So they're just out here strolling with their friends and wondering where mommy is. Yeah, so like I mentioned, this is some of the questions that, if you can, please avoid just being so inquisitive, like, what's going on, what's happening to this. And then there's this other aspect. this one I've mentioned before, like you get it depends with the type of breast cancer you have. If it's hormonal, you get drugs that suppress your hormones, and these hormones, they give you a lot of hot flashes all the time. You're here sweating. So yeah, you try to just be normal, but it's the new you. It's part of you that you have to get adjusted to it and just live with it. Then there's this other side effect that I got when because with mine I had 8 cycles of chemo. So the 8 cycles of chemo were divided into 4 cycle 1, cycle 2. So for cycle 1, I had I'm still looking at these little humans. Oh, they've given up now. They want to go home. They can't find mommy. No. Poor children, God bless them. Yeah, so like I was saying, the cycles have been they were divided into 2, cycle 1, cycle 2. So cycle 1 had 4 sessions and cycle 2 had 4 sessions. So the side effects in cycle 1 was the hair loss, and yeah, the darkening of skin, the darkening of the feet and the hands, and what was there? Yeah, I would get nauseated, fatigued. Yeah, cycle 1 was crazy. Yeah, the tongue turned, it was black. So these are some of the side effects that were there in cycle 1. But I had my own ways of handling it. Yeah, there are days things were tough, but you have to soldier on because you don't have a choice. You have to do it. Then cycle 1 was done. I accepted the new me, the bald me came in. I accepted it. I remember initially the first month, I was a bit uncomfortable just walking around with my bald head because people would look at you and just ask you, hey, you just woke up one day and just decided to go bald, yeah? And you can't keep on telling everyone what's going on. Yeah, so I decided, at the end of the day, this is my life, and I have to accept it. So I have to live it. I can't be hiding under a wig every time. Yeah, I wear a wig once in a while when I just want to feel the hair thing going on. Yeah, but most of the time I'm always rocking my natural hair like that. So yeah, cycle 1 came in, ended, then came cycle 2. Cycle 2 was smooth. Yeah, I didn't experience so many bad side effects. Like I would go in, get the medication, and just leave the hospital feeling okay. Unlike cycle 1, where the moment they would just administer those drugs, before I even step out of the hospital, the nausea, the vomiting would start. At least cycle 2, it subsided and I didn't have it. But by the end of cycle 2, I started developing like a tingly feeling. I started developing a tingly feeling on my hands, in my feet. Like it got so bad that I started even now missing cycle 1. It was so bad. I would feel like I have like over 1,000 needles just pricking my hand, pricking my feet. Like it was really bad. So anytime it would basically start attacking me in the evenings, and before I didn't know it, like it was because of the cold. Like when it gets to the evening, it's a bit cold, so I didn't know that was also triggering it. So the doctors would tell me, just make sure you moisturize, you have your gloves on all the time just to stay warm. I tried that. I bought all sorts of moisturizers, but nothing. That feeling wasn't going away. It lasted for I think, was it like for a month? Yeah. every evening I would just lock myself in my room, and whenever it started, I don't know where to scratch. I would get a stone, try to scratch. I would get, I don't know what, try to scratch. My daughter would know. Anytime she would see mommy just acting weird in the living room and just heading towards my bedroom, she would follow me slowly in the bedroom, and just go up on the bed and start scratching me, because there's a time I remember it left the hands and the feet. Now it moved to my body. I don't know why, because most of the patients get to experience this only with the hand and the feet, but now it got to a point like this thing had shifted. So I would scratch the whole of my body. I'm here scratching my body, I'm here what. So my little girl would try and help me do this, yeah, but it's all a matter of time. That phase came, we dealt with it, and it was over. The good thing, like, I would like to encourage all cancer patients out there, the good thing about these side effects, they are not a lifetime thing. They are not things that will come here and like you have to live with these side effects forever. No, it's just a matter of time. You put all this behind you, whatever you're going through, whatever you have to endure, just put it right behind you and just focus on the main goal. Like, I need to stay very positive. I need to stay very positive, because at the end of the day, I need my health back. And with that, you'll fight it because you won't have your mind drifted like, oh, this and this. No, you have, like, you still have the main goal, which is getting well. It's just a matter of time. It's honestly a matter of time. Look at me here right now. I started the treatment in February, yeah, and it was a whole year long treatment plan, because when the doctor was saying we'll get done with this treatment in November, to me it sounded like, I don't think it's gonna be possible. It sounded forever, but I stayed put, I stayed patient, I followed every single instruction that the doctor told me, and every day he kept on encouraging me. Every day I kept on having the love from my friends, from my family, from everyone, which kept me going. And I forgot, I tried as much as I can just to put all this negative vibe behind me. All this, my main point for today is, like, focus. Just focus on the goal. Focus on, like, you need to get better. You need to get well. Like, your family needs you, your people need you. So let it be your goal. Like, I'm gonna get well. I don't need to look at yes, these side effects are here, but I'm gonna live with them for the short period they are with me here, and I'll be fine. Yeah. So I just wanted to really encourage those fighting so sorry guys, I got distracted out there. So like I said, my parting shot for this video is just to encourage those who are still going under treatment. Like, it's just a matter of time. It's just a matter of time. Stay focused on the goal, and the goal at the end of the day is just getting well and just getting back on your feet, healthy and strong. Stay put to it. Stay set on the goal. Pray. Prayers works wonders, and God always answers prayers. And to everyone going through treatment right now or going through this journey, I pray that you quickest recovery, and I pray for strength from God. I love you all, and I wish you the very best and quickest and speedy recovery to all those going through treatment. So kindly subscribe, kindly like, and share my video. We'll meet in the next video again. Bye, and I love you.